Before we get started, I wanted to talk a little bit about my basic approach because it might be different than what you're used to if you studied TCM. Of course, I studied TCM in school and I've taught TCM in acupuncture colleges for over 20 years. But my major influence in terms of acupuncture was Japanese meridian therapy, which I started to study very early on in my career and have really based my treatments around ever since. It's based on a five-phase root pattern. The methodology comes from the classic of difficulties, and I'll talk about it a little bit more in just a moment. Basically, the diagnostic process is what we're all used to, questioning, pulse, and tongue, and then there's also abdominal diagnosis, which is very common among Japanese practitioners. With all of that, I identify the five-phase pattern, but also the pathomechanism as it would be identified in TCM. And the pathomechanism is what is used to inform not only the root pattern selection, but also the points that I use as well. The root treatment points are selected according to the pattern and the pathomechanism. The pattern is the channel combination, usually the mother-child combination from Nanjing, classic of difficulties, but oftentimes I will use the pathomechanism in order to determine the exact treatment points that I'm going to use on those channels. For example, I might use the standard point actions or indications that you would find in a Chinese medicine book, or I might use the system of 5 tastes according to the 5 phases, point names, various other data points that I would use to select my treatment points. And then typically I'll use symptom control points as needed, but the pattern is the most important thing, and thus the selection of treatment points that fit the pattern and the pathomechanism are the main thrust of my treatment and of this discussion.